This is the Coronavirus Daily Briefing for Wednesday, March 18th, 2020. I'm Brian McCullough. The U.S. has passed some unfortunate milestones. The Pentagon is donating materials to the healthcare system, first-person accounts of what it feels like to have the virus, lessons from the mortality rate in Italy, how many cases are likely in the U.S. right now, and some of the biggest myths about COVID-19 busted. The U.S. passed the 100 deaths milestone last night, and there are now cases in all 50 states and the District of Columbia, as West Virginia reported its first case last evening. The number of known cases in the U.S. is now more than 5,600. Quoting the New York Times, most of those who have died from the virus have been in their 60s or older, and several have been in their 90s. But other patients who died have been younger, including a corrections worker in New York City in his 50s and a man in the Seattle area in his 40s. Though Washington, New York, and California account for about two-thirds of the country's coronavirus deaths, 14 other states have reported at least one fatal case of the illness, end quote. The Pentagon is providing millions of face masks from its reserves to healthcare workers, up to 5 million N95 masks in total, and it is also making 2,000 of its ventilators available. The Pentagon is also considering stationing the hospital ship Comfort, often used during natural disasters overseas and containing 1,000 beds, in New York Harbor in order to free up beds in Manhattan area hospitals. Kansas became the first state to close schools for the remainder of the academic year. Nevada has shut down all gambling and all casinos in the state as of today. Chicago's Midway Airport had to issue a ground stop on Tuesday after several technicians in the air traffic control tower tested positive for COVID-19. Flights continued at the airport at reduced levels as the tower was being cleaned. The U.S. and Canada appear to be in talks to mutually close the 5,500-mile border between our two countries. The European Union is closing its borders even to member countries. Those listeners not familiar with Europe might not know what a big deal that is, quoting the Washington Post. Until last week, citizens of the EU could move across the continent with ease, even as the virus slowly spread through its population. Just as any resident of Maryland can easily pack bags and head to Virginia, so too could a Pole cross into Germany. The about-face in Europe is proving as disruptive as it would be if U.S. states imposed border controls on one another. And since Europe's countries are no longer built for self-sufficiency and no country manufactures or grows everything it needs, the effect of the internal blockade could quickly become catastrophic. Already, trucks trying to enter Poland from Germany were backed up 25 miles on Tuesday as Polish border guards checked drivers' temperatures, overall health, and documents before allowing them through, end quote. Dr. Neil Ferguson, that outbreak modeler that we mentioned in the segment about the response in the UK yesterday, tweeted last night that he has come down with symptoms of the disease himself. Quote, sigh. Developed a slight dry but persistent cough yesterday and self-isolated even though I felt fine. Then developed high fever at 4 a.m. today. There is a lot of COVID-19 in Westminster, end quote. There has been an alarming uptick of cases in South Korea. Quoting the Washington Post, Kwang Young-jin, the mayor of Daegu, the southeastern city where more than 6,000 coronavirus cases have been recorded, said on Wednesday that 74 new infections can be traced to the local hospital, which specializes in care for elderly patients with Alzheimer's disease. South Korea's health authorities ordered a thorough inspection on 1,435 nursing homes and hospitals nationwide earlier this month after multiple infection clusters emerged in elder care facilities. Kwon said the most recent cluster was found during those inspections. A dozen more cases of the virus were reported in nursing homes and hospitals in the city on Wednesday, he said. 93 new cases were reported in South Korea overnight, though this does continue South Korea's hopeful trend of recording fewer than 100 new cases several days in a row now. And while local new cases in China and Taiwan continue to drop, there is increasing concern about imported cases from outside those countries. Taiwan has closed its borders to all non-resident foreigners who are not diplomats after the number of imported cases, quote, increased sharply. And again today, China reported only 13 new cases, but only one local case and 12 imported ones. Today's episode is going to be full of a lot of tweet storms. let's start with some tweet storms from folks who have actually contracted COVID-19. Now, all of the caveats in the world about this, because we can't be 100% sure who is behind these accounts, but after doing plenty of Googling around, I have no reason to doubt the two accounts I'm about to read to you. I think it's important to share first-person accounts because it's important that we viscerally understand what it's like to contract COVID-19 so we can be sober and realistic about what's at stake. Listen to these so that you have an understanding of the symptoms if they come to you, but also listen to these so that you can understand the realities of the disease. The first comes from Justin at JWDaddy80 on Twitter. Quote, I have it. Don't sleep on this thing, people. I'm a very healthy type 1 diabetic. My body is fighting it very well, but it's kicking my ass. Don't be a moron. Stay home. I'm 39, so use that for what it's worth. I know everyone will be curious. I would be too, so here we go. March 4th, I began getting a headache that I could feel in my lungs, which is weird, but everything is blooming, so I chalked it up to allergies. My breathing became progressively more labored and began to hurt. Last Friday, I went to the ER because I nearly passed out for no apparent reason. By that point, it hurt to breathe. I mean, inhale and exhale. To go along with this freaking headache, it's uncomfortable. Friday, they treated me for the flu, gave me Tamiflu, some Motrin, an inhaler, and sent me home. They said if I felt worse to come back, so I came back. Today, it hurts to breathe so much. Walking to the bathroom is like running a marathon. The headache doesn't get any better, which blows dead bare. Don't think chest pain like a heart attack or flu. This isn't the flu. We all pretty much know the flu. Think deeper. Think lung pain. It's hard to visualize, but think when you breathe cold air and that pain before your lungs warm back up, kind of like that, I guess. The Motrin made me feel worse. The inhaler makes my lungs hurt worse. With the inhaler, think of you cutting yourself and applying alcohol to the wound. It's kind of like that, applying medicine to a wound. My lungs are angry, so the inhaler is opening them up so they hurt more. Today, they gave me some prednisone to help my lungs out. That's the worst part, the constant lung pain. So hopefully the inflammation goes away with that. Now I'm home and quarantining with my family. If I feel worse, I need to go back. So far, my vitals are great. Oxygen is 100%, but the next few days can really kick my ass. If I drop below 90%, I get oxygen. 85%, I get intubated, and at that point, it becomes scary. This is no flu. The flu is its own thing. This feels so much different than the flu. I just have lung pain and a headache. Others have it different depending on how well their body fights it, health, age, smoking, etc. Thank you for reading. You're all amazing. Let's have an 805 together once the season starts, end quote. And the second personal account comes from Chris Gao at GaoCJ on Twitter, who claims to be a doctor, an anesthetist, and intensivist. Quote, now that I am recovering from COVID-19, I want to share my symptoms and my experience in case it is of help to anyone else. I've felt pretty rotten the last few days, but am finally improving. I am only talking about my own experiences as a patient, not a doctor. I'll have a quick moan about testing and then go through my symptoms. Testing, testing, testing. We must stop the ridiculous imbalance where politicians and sports stars can apparently get tested, but frontline health workers cannot. The criteria must be consistent. Symptoms. Day 1, the day of fevers and exhaustion. Shivers and sweats were the story of the day. That and being utterly exhausted with whole body ache. Random temperature of 38.5 Celsius. One flight of stairs, then stop for a rest. No appetite at all. The cough started in the afternoon. Not a bad cough and not productive, but just there every now and again to remind me that my lungs were also not happy. I found out my brother, who I spent the preceding week with, is unwell with similar symptoms. Day 2, no energy. Horizontal is the position to be in. Sweats, shivers, ongoing, but not as bad as yesterday. Cough more noticeable, but not a big issue. Intermittent headache started. Whole body still aches and feeling weak. Zero appetite. Felt a bit brighter in the evening. Day 3, feeling worse. Headache and fatigue worse. Cough less frequent. Appetite improving, but far from normal. Another day of frequent naps and predominantly horizontal state. Had to help with childcare in the evening. Either baby has doubled in weight or I'm half as strong. Day 4. Ongoing fatigue and reduced appetite. Cough very infrequent now. Headaches still present but improving. Whole body still aches. Functionally pretty useless. Would quite like to feel better. My brother is improving. His girlfriend now has symptoms. Day 5. Still pretty tired. No headaches anymore. Appetite up to half or 2/3 of normal. Still no desire to leave the bed/sofa, let alone the house, which is fortunate since I still have 2 days of self-isolation to go. Day 6. Feeling a little better. Or thought I was, but then fell asleep on the sofa for an hour. So fatigue ongoing and lacking energy. Still no desire to leave the house. Hoping tomorrow will bring much more energy. That is as far as I've made it so far. If you meet the criteria, a temperature greater than 37.8 Celsius, or a new cough, please follow the advice and self-isolate. Protect your patients, protect your colleagues, protect your friends and family, protect yourself. End quote. And this tweet storm is from Luca Dell'Anna from Italy. He is the author of 5 books. On his website, he calls himself an independent researcher on nonlinearities, complex systems, and emergent human behavior. This is a tweet storm where he speculates on why the mortality rate might be so high in Italy. Again, all of the caveats in the world, but I thought there were some interesting stats in here. Quote, mortality in Italy is one of the highest, hovering around 7%, while for other countries we see 0.5% to 3.5%. Let's see the factors that contribute to know which might apply to your country. One factor is that the virus has been in Italy for months. People take time to die. Countries which see a low mortality might have many in-trajectory deaths, which don't show up yet in the stats. This is, by the way, why age of death goes down over time. As a general rule, exceptions apply, older people die faster. We have few young deaths because 1, young people die less, and also because 2, young people take longer to die. There have been early reports that Italy didn't use chloroquine, but they do now. I have no idea how much this factored in regarding the first deaths. Healthcare system is not a negative factor. Northern Italy has one of the best healthcare systems in the world. If it's swamped, it's only because of the sheer number of patients. Any healthcare system would be overwhelmed with an uncontrolled outbreak. Mortality is high in Lombardy also because the system is overwhelmed by the number of patients, which means less care can be given to each on average. If you think this won't apply to your country, perhaps, but it only depends on how well you implement social distancing. I stress the last point. How many beds your hospital has is largely irrelevant. Having 50 or 200 ICU beds in a hospital doesn't matter much if it receives 400 patients over 2 weeks. Healthcare systems and hospitals are mostly inelastic, which means how they resist under overload mostly depends on the load, not on their internal characteristics. This is why social distancing is so important. Countries with lots of beds and low initial mortality, for example Germany, should be especially wary of not falling into complacency. This is an advantage if and only if the total number of cases is limited through social distancing. No healthcare system can withstand a full outbreak. Finally, age. As of a few days ago, the average age of death in Italy was 81. However, if your country's population is younger, it will only be marginally better for you as the average age of death tends to lower over time, especially if hospitals get overwhelmed. As seen above, in the long term, the most important factor is the number of cases. The final implication, the most important action to lower the final number of deaths is to reduce the number of cases. This should be done by implementing strict social distancing as early as possible. Any new case today means 2 to 4 deaths down the road. Additional reasons for the high mortality rate here. Italy is only testing severe cases because they got swamped, whereas South Korea tested more broadly. Italy tests post-mortem, Germany does not. I got asked why I said that hospital capacity is inelastic. Of course, there is some elasticity. A few more beds can be added and equipment procured, but elasticity is negligible with respect to the growth of an uncontained outbreak. I got asked, isn't Italy having an outbreak because of the high quantity of Chinese workers? No. In the Prato area, one of the largest Chinese communities in Europe, there is a low COVID incidence. Also, no Chinese cases near the epicenters. Do people in Lombardy die more because they smoke smoke a lot? No. 22.5% of people aged 14 plus smoke in Lombardy. 24.5% of people aged 15 plus smoke in Germany, end quote. Businesses of all sizes, these are potentially difficult times, of course. So right now, any tools that can help keep operations running are more than welcome. Stamps.com is one of those tools because it can help you keep your shipments and business-critical correspondence going. Anything you could do by going to the post office, you can do without going out, simply by going to Stamps.com. Stamps.com brings all the services of the U.S. Postal Service right to your computer. Whether you're a small office sending invoices, an online seller shipping out products, or even a warehouse sending thousands of packages a day, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier or drop it in a mailbox. It's that simple. Plus, you get discounts with Stamps.com that you can't get at the post office. So stay indoors, but stay in business as well with Stamps.com. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing for your free trial, BRIEFING. Stamps.com, enter briefing. Finally, for the tweet storms, I think this one is important as well. We've all heard a lot of things like, for example, the coronavirus may go away when the weather turns warmer. Well, Dr. Fahim Yonas, Chief of Infectious Diseases at the University of Maryland Upper Chesapeake Health Hospital, has written an excellent tweet storm tackling this and other coronavirus myths. The link to the full thread of tweets is in the show notes, of course. Given the prevalence of myths doing the rounds, I'm going to quote from it extensively here. Number 1. Coronavirus will go away in summer months. Wrong. Previous pandemics didn't follow weather patterns. Plus, as we enter summer, there will be winter in the southern hemisphere. The virus is global now. Myth number 2. In summer, the virus will spread more due to mosquito bites. Wrong. This infection is spread via respiratory droplets, not blood. Mosquitoes don't increase the spread. Myth number 3. If you can hold your breath for 10 seconds without discomfort, you don't have COVID. Wrong. Most young patients with coronavirus will still be able to hold their breaths for much longer than 10 seconds, and many elderly without the virus won't be able to do it. Myth number 4. Since COVID testing is unavailable, we should donate blood. The blood bank will test for it. No blood bank is testing for coronavirus, so this attempt will fail. Blood donation is a sacred exercise. Let's make sure we are motivated by the right reasons. Myth number 5. Coronavirus lives in the throat, so drink lots of water, and the virus is pushed into the stomach where the acid will kill it. No. Virus may gain entry via the throat, but it penetrates into the host cells. You can't wash it away. Excessive water will make you run to the toilet. Myth number 6. All this social distancing is an overreaction. You'll see that the virus won't cause much damage. Wrong. If we don't see many infections, as I hope, it actually will prove that social distancing worked. Not that the virus was never a big deal. Myth number 7. Car accidents kill 30,000 people annually, so what's the big deal with COVID-19? Well, car accidents are not contagious. Their fatalities don't double every 3 days, and they don't cause mass panic or a market crash. Myth number 8. Hand sanitizers are better than soap and water. Wrong. Soap and water actually kills and washes away the virus from skin because it cannot penetrate our skin cells. Plus, it also cleans visible soiling of hands. Don't worry if Purell was sold out at your supermarket. Myth number 9. One of the best strategies to prevent COVID-19 is to clean every doorknob in your home with disinfectants. Wrong. Hand washing / maintaining a 6-foot distance is best practice. Unless you're caring for a COVID patient at home, your home surfaces should not be a big risk. Myth number 10. COVID-19 was deliberately spread by, depending on your politics, the American or Chinese military. Really? I don't think we even have to address that one. That's it, folks. Be well, be kind, have faith. See you on the other side. This too shall pass, end quote. So you might have been listening to stories from Seattle, from New York City, from Italy even, and you might have thought, that's still so far away from me. Well, let me share a story from the Atlanta Journal-Constitution in the U.S. state of Georgia. Quote, Phoebe Putney Health System may be the canary in the coal mine. Its flagship hospital in Albany, a city anchoring southwest Georgia, has exploded with possible COVID-19 patients in the last 5 days. The hospital now houses 65 patients who've either been diagnosed with the disease or are waiting for tests to confirm the diagnosis. That's just the inpatients. 115 more with less severe symptoms are at home, waiting for test results. The hospital released the numbers along with a plea to speed up testing. Phoebe Putney's other hospitals have even more cases. The hospital system is well funded and connected for a rural one, but, says CEO Scott Steiner, they've run through 5 months' worth of supplies in 6 days. They're good for another 5 more days, he thinks. We might have thought we were overprepared, Steiner said, looking back at the system's years of disaster planning. But you just can't believe what we went through from a supply standpoint. This event is unlike anything anyone has ever seen, Steiner said. You can throw in SARS and H1N1 and Ebola. There was Hurricane Michael. That was a big deal. But the thing is, Hurricane Michael came and went. And then you kind of pick up the pieces. We're 6 days into this here? And it doesn't appear to be slowing. Is it only a matter of time till all others feel the same? End quote. The story goes on to say that this Monday, the Albany Hospital set up a drive-through testing apparatus, and that the hospital system overall has been trying to identify employees willing to sew masks if they can't find enough. As of Monday, the state of Georgia had 121 confirmed cases. There are presently 5,702 reported cases of COVID-19 in the U.S. But scientists studying the spread of the virus in China have indicated that for every reported case, there are probably another 5 to 10 people with undocumented infections. So what is the true number of cases here in the U.S.? Here's a potential rule of thumb, quoting from the New York Times. Researchers modeled the virus's natural spread in China before the government instituted a travel ban and an aggressive testing policy. During that time, from December of last year through late January, about 6 in 7 cases went undetected. That situation is analogous to the current state of affairs in the United States and other Western countries where tests are not widely available, the researchers said, end quote. So going by that rule of thumb, the roughly 5,700 reported cases we have presently in the U.S. could actually be more like 28,000 to 57,000. The scientists called for a radical increase in the identification and isolation of currently undocumented infections. That is, more testing. Together with social distancing, the scientists said this would increase reporting rates, reduce the proportion of undocumented infections, and decrease the growth and spread of infection, end quote. They added, in some good news, that the testing and lockdown measures implemented by China after January 23rd did work to reduce the rate of spread of the virus. This show has been produced by Ride Home Media, written by myself, along with James Welsh and Jackson Bird. Follow me on Twitter at BrianMCC to follow all of my likes, all of the stories we are considering over the course of the day. I like in real time in order to save them. And please, if you are finding this show helpful, please write a review of us anywhere you can, but especially in the Apple Podcast app. It helps new people discover this show when you leave ratings and reviews. Talk to you tomorrow. Be well.